Yes, yeah. Right. So if you have read and understood, considering the communication skills station, can you please begin?
Hello, Mr. Ahmed. I'm Dr. Mohammed Shirbini, one of the surgical doctor here.
Hello, doctor.
Hello. I have been asked to talk to you about the surgical procedure I would like to perform for you. May I ask you first, what do you know so far?
Actually, I don't know many things about this procedure. Could you please illustrate it for me, please?
Okay, we call it esophageal which is abbreviated to OGD, which is a procedure in which we introduce a small camera through your mouth, going down through your food pipe, then to your stomach, and may extend to your first part of a small bowel. This camera will relay an image on a TV, which give us the chance to take a look inside. We may also do some widening of the narrowing part of your foot pipe and take some samples to examine and give us more information about your condition and figuring out your case. Actually, this will occur under general anesthesia, which means that you will sleep during the procedure and feel no pain.
Oh, doctor, but I think it's a major procedure. Is it really painful or not, doctor, please?
As I mentioned, it will be under general anesthesia. You will feel no pain, and I really appreciate your concern. But let me tell you that no procedure without any risks. But this procedure will be done under a skilled and experienced surgeon. Only a skilled and experienced surgeon are allowed to perform this procedure. So there are many possible risks here. Let me clarify them for you. They include bleeding for the sample side. They include some damage to one of your teeth while introducing the camera, and experience some sort of chest infection. But the most serious one is cutting through your the wall of your food pipe. Do you understand me?
Yes, I understand, but you are talking about risks, so it's a risky operation then. No, doctor, I don't want to do this operation. I'm afraid, actually. I'm afraid.
I totally understand you and really appreciate your concern. But listing this risk doesn't mean that they will happen. As I mentioned, only experienced and skilled surgeons are allowed to perform some procedure. This procedure will help us figuring out the cause of your case. So I advise you to do this investigation. Are you okay with that?
Doctor. Okay, doctor. But is there anything else? Anything else? But I don't want to do this procedure. You can tell me anything else, please.
Actually, this procedure will give us more information about your condition by taking a sample and by making a widening of the narrow part of your food pipe. This will relieve your symptoms. This will relieve your difficulty in swallowing. So it's advisable to do this procedure. Are you okay with this?
Okay, I understand. But can you tell me why I keep salivating from my mouth, please?
Actually, I have seen with your blood some derangement of your kidney function along with salivation. This may be occur due to the narrow part of your food pipe. And as I mentioned, we are going to make widening of this part. I think this will be improved as this narrow part prevent downward movement of your secretion smoothly. Is that okay with you?
Yes, it's okay, but Doctor, please clarify it for me. Is it a cancer? Please tell me.
I totally understand you and really appreciate your concern. Okay, cancer is a possibility, but it is too early to judge your condition. We have to do the procedure, and we may need some other investigation to give us more information and figuring out your condition. Is it okay to you?
Another investigation other than this? What other investigation you will do, doctor, please?
Actually, we are going to take samples from the lining wall of your food pipe and examine it. And if we found any suspicious of cancer, we are going to do some imaging, such as CT scan, to give us more imaging of your total body to see if there is any other suspicious lesion within your body. Do you understand that?
Yes, I understand.
Mhm.
But the doctor told me before that I have to decrease my food and to eat a special food and to do exercise. I can do all of this, but can these things prevent me from doing this procedure, please?
I'm afraid not, because this procedure it's advisable to do the procedure now, as I mentioned, to give us or figuring out the cause of your condition. It will be important to confirm the diagnosis or make sure of your diagnosis by this procedure. Other things can relieve the pain, but not giving us the diagnosis of your case.
Yes,
Uh,
yes. Okay, doctor. If I accept for this procedure, when the result of my sample will appear, please?
It usually appears within 2 weeks frame. I really appreciate concern, and I will make sure to contact you when it is available. Are you okay with this?
Yes. And if I have done this procedure,
Mm.
do I have to stay in the hospital after it for a while, or I can leave?
Actually, because this procedure will be done under general anesthesia, you have to stay. We will need overnight admission, and you can go home by the morning to make sure complete recovery has been obtained. It's advisable to ask someone to accompany you during this procedure to go with your home, because it is you will not be allowed to drive after this procedure. You may feel some drowsy after discharge.
Okay. If any complication appeared for me, is the hospital is responsible for any complication to fix it or to repair it, please?
Actually, no procedure, as I mentioned, no procedure without any complication. So, if there is any complication, and the most serious one, which will need surgical repair, is cutting throughout your food pipe lining wall. So, it will need open surgical repair and repair this cutting through. Are you okay with it?
Yes. Okay, doctor. Okay.
Do you have any other question to ask?
No, no, no,
Okay.
thanks.
I hope you are a bit recovery from that.
So
Thank you, doctor.
at the end, check understanding of the patient and make patient sign the consent form.
Okay, I'd like you to sign a legal document that make sure that you understand me and you are accepting doing this procedure.
Yes, I will sign, doctor. I will sign.
Good.
Can you?
Thank you. Oh,
Okay, just 18 seconds left. All right, good. This was good. And
yes.
at the same time, your leaving number with the nurse. So if the patient wants to ask anything, they can contact you. 5
Okay.
seconds, 4 seconds. Yes, good. Right.
Okay. Okay.
Then, yes,
I'd like to, if you want to stop recording before
yes,
asking or what? Okay.
you can, yes.